Yes, so we have the next speaker on in line, is Mr. ANANTHAN KSC, the Director Operation of Sukraa Software Solution. And he is actually the founder and director of Sukraa. And he has done commendable job in putting things together to make life easier for everyone around, including in healthcare system, by putting a lot of strategies and sales and marketing plans to reach out, engage, converting prospects into profitable customers. His skill set plays a crucial role to strategize capital structures, working capital, and in utilization of company resources effectively and efficiently. So you would notice that this term effectiveness and efficiency is being used repeatedly because that's what is coming up in time to come. He devised strategies to formulate resource gap between present and future capabilities, and he possesses the ability to accomplish a task, get it right, rather than get it done. And I will let it get it right at the first time. He is a commerce graduate from Vivekananda College and MBA from Madurai Kamaraj University. And Ananthan is going to speak on smart technology help to build quality of care. So with this, I would like to invite Ananthan. Please come up and take your floor for your presentation, please. Thank you.
Good morning, everyone. I first thank the organizers and Dr. Rana for giving me this opportunity. I am Ananthan KSC, the founder director of Sukraa Software Solution Private Limited, Chennai. I'm here to share a few thoughts on the smart technologies. So it's going to help a quality care. Before getting into the presentation, let me explain about Sukraa Software. Sukraa Software is a technology company with like 15 years of experience. And we have footprints in overseas like Africa, Middle East Africa, Nigeria, and then we have clients in Rwanda, South Africa, Botswana, and Middle East, Oman, and Dubai, as well as our neighboring countries, Sri Lanka and Nepal. So to talk about Sukraa, it's like we have defined Sukraa as going to be a product company. So what's the difference between a product company and a development company? Over the years, like 15 years of experience, so we know like what exactly the hospital or healthcare environment requires to be function. So based on that, we inbuilt a very strong functionalities into the product, and we want to position it as a product. So product is like any future changes, anything it just go through a product life cycle. It's more on the technical side. So we generate 30 million records annually through our system. And we are very strong in equipment analyzing interfacing. So like when Dr. Jacob is talking a lot of like technologies, like we support in those technologies. So like any of the lab equipments or vital signs, we are working with few of the ICU and CCU equipments to get it automated and support the healthcare fatality for the doctors and nurses as well. So we have 300 plus API clients across the globe. So talk about software solutions, we have three major products. One is on the LIS, we call like Laboratory Information Systems, and the HIS, Hospital Information Systems, which has got nearly 30 plus modules, and we've got a clinical information systems and EMR. So let me get into the presentation. So what's a smart technologies? So any hospitals use technologies, IT services or solution, which will enables to connect and engage, helps the people to work better, faster, and smarter. This is what the tagline I would like to talk about the smart technologies in hospital. So there are few technologies which is going to be a value added in hospitals. So this some 7 things like there are very small means like technologies on very high level technologies can be utilized. So like I'm going to talk about a barcode system, QR code, smart card, and some of the IoTs, artificial intelligence, and the BA, the business intelligence, how an hospital can utilize those technologies to have perform a better quality care for their patients. So let me explain you each. There are 7 topics which I'm going to explain today, and I'll show you some of the solutions and benefits on adapting these technologies, and with some few case studies as well. This is what my today's session is going to be. So barcode, so what is the AIDC is like automatic identification and data collection. And the solution which is going to be used in this technology is like barcode, QR code, RFID, smart card, even like a queuing system, everything is there. So the idea in implementing this technology is like how to improve your efficiency with a error-free system and increase the productivity and increase the patient confidence. So when you got a barcoding system across the hospital environment, right from the patient registration to the discharge, and even the allied functions like lab, pharmacies, departments, if you're going to implement those systems, it's a very simple technology which helps to make the life simpler. It can be a pharmacist or a nurse or a technology from a lab or a radiology perspectives. So this is what some of the benefits you'll be getting it through this technology. So you can see here where exactly these barcodes can be utilized. So when you talk about the lab, so when you start with the lab, like when a phlebotomy is where the lab sample can be collected, so it gives a full patient confidence. It tracks right from the sample. It integrates with all those equipments, and the data is being pulled out from the equipments automatically, and this simple barcode helps to automate the entire process, by which the result is all accurate and error-free results can be obtained. You can say a simple like a smart card for hospital registration. You can inbuilt barcode and a QR solution is be there. The idea of this technology solution is like no need to repeat again and again. So when a patient walks in, you can do a registration, and it can be used in pharmacy or a lab on just scanning this barcode or QR code solution itself. So this repetitive can be avoided and productivity can also be increased. So same like, so the hospitals invest huge in the assets, like a lot of ICU equipments and lab equipments is there. Through a simple barcoding system, it will helps you to analyze whether the equipment is maintained properly, whether the quality of the equipment has been maintained. Everything can be tracked through a simple barcoding system. So now you can see there the QR code, the PCR, everyone is aware that PCR, for every PCR report, a QR code is there when it's going to have an international travel. So the simple QR code can be utilized to retrieve the patient report. It can be through in the government portal, or it can be through a lab server as well. And the other one is on the pharmacy side. So there's a huge challenge in maintaining a stock of the pharmaceutical items, like whether it's going to be expired one, or number of quantities available, minimum stock available. Everything can be tracked with this simple barcode solution or QR code solutions in the pharmacy level. So this is on the, it's a simple technology which enables the life easier across the hospitals. So you can use it in the entire hospital environment. So next I'm going to talk about the health information technology. So like before Dr. Jacob has been saying like technology has to be support. At least 20 times he's been talking about the technology. Yes, we are there to support there. So there are some solutions, like there are 50 plus, but I'm going to talk about few solutions like the CPOE is a computerized physician order entry, and the EMR, nursing and accident and emergency, where a technology is going to be more useful. So the medication, the benefits are like medication administration. So definitely there are going to be reduced errors where a doctor can prescribe through a system. It's been available in a pharmacy level or in a laboratory or radiology. Anywhere like the data is available, and it can be, the errors can be there. The legibility of order can be maintained, and it helps in to retrieve all the history data, like, so when a patient is coming, so when it comes again and again. So for diagnosis purpose and give a proper advice, the data is very important, and this will helps you give a proper diagnosis. For that, so the system helps you in giving a easy documentation, fast easy documentation can be, benefits can be attained. And one more thing is on the clinical decision support. So which a lot of data is available. The doctor can give definitely a proper clinical decision support. We have inbuilt artificial intelligence solutions through a laboratory automation, whether it's a patient is prone to an cardiac problem or a diabetic or even like a thyroid problem. So which I'm going to explain in my next slides as well. Safety can, definitely the safety and medical errors can be reduced when you're going to adopt a full solution, technology solution there. So some of the screens, I will get into a live screens where you can see a feel of it, how the solution is going to be there. You can see here the vital signs. So I can, again, my previous speaker, Dr. Jacob, is talking about how to integrate all the vital signs. So we have a inbuilt IoT solutions. So if the equipment is capable, we can able to pull out all the data from those equipment, right from the vital signs to the lab equipments or even ICU equipments. It will help you to plot the graph. And you can see there whether it's pressure, what's the, now the challenge is like we don't have data. So when the patient walks in, we don't know earlier what has happened, they need to get into a manual thing and it's going to take a lot of time. So we want to achieve like, no, it's going to be much faster than a writing itself. So that's the prescription, like it's going to be much faster. We have even inbuilt some few talking as well, like voice recognition, the dragger, and one word in from Delhi-based company. We're working through that to make the doctor's life easier. You can see the trend of a vital signs. So entire thing can be captured through the IoT systems, and with the help of the data, the doctor can able to give a proper diagnosis and advices. Here again, earlier talking about the early warning screening in emergency. So here you can see this is as per the international standards. There are points being there, and if it can even get into a code blue. So when it's like a code blue, it's even alert to the nursing code blue team or a nursing and even the cardiac doctor, and the doctor can before he rush to the hospital, he can prescribe few advices to the nurse to take care of the patient as well, by which the patient can be taken care at a very early stage. So this you can see the color codification, like it's red is alarm and no orange, and it depends on the purple or an code blue team. It can depends on the department specialty wise, it can be defined. And the advantage is like the data is automated, so no need for manual entry. So that's the one of the interesting part through the IoT, which I'm going to again explain in the next few slides. See there you can see there's a lot of here few assessment forms. So when the patient is coming, whether you can ask him to build by himself, or it can be even captured through a tab. It's like a simple screens, whether it's a diabetic or hypertension. Even a few 6 parameters, even you can predict patient can be prone to a cardiac arrest or no within like 4 years or 5 years. To that level, we are building up some algorithms with the doctor advice as well. This is an inbuilt tool where you can generate as much as assessment forms based on the specialty, and the department wise can be generated. So this really will help you to, this can be done by a nurse or a front office person itself, and helps the doctor to give a proper medication and advice to the patient. Okay. Same like this, the creatinine on the lab side. So all the numeric data can be plotted as a graph, even like the text, some of the positive, negative, that can also be given in a very good representation in a different format. You can definitely see, you can see here, so that is a normal high value and the low value range, where what is the result value. So this, the graphical representation will definitely help a doctor to analyze whether because of my medication is this the value has come down or it can be increased. So like for example in creatinine, the higher value is very important than a lower value. So that's what our doctors used to say. So based on those knowledge, and we build in a very robust AI technologies, and through an IoT we come out with a very good graphical representation to help doctors as well. Okay. So here that's one more thing in the pharmacy level, where we can see here how a drug can be scheduled and maintenance. So like there are a lot of prescriptions given by the doctors, whether it is administered properly by the nurse, how it going to get track of it. Through a small tab solution, all just need to enter is like when who has prescribed the medicine, what is the dosage, and everything is automated. And more importantly, you can see here what is the nature of drug. Is it a narcotic or notified, which gives a very clear identification of the drugs, whether on top of it, whether drug is available or not. This helps to give a very quality care for the patient as well. So even in pharmacy, like there are some kind of sound alike, look alike, antibiotic, food reactions, a lot of concepts are there. So here in India, we use a simple billing systems like to just do a registration and just come out with some of the revenue only. More than that, to have a better quality care, we should build in some good systems which to retain the patient as well. I'm hearing some patients being going to many hospitals. One of the reasons is we don't have a proper data for the doctors to know to analyze and give a proper medication. These systems should definitely help the doctors as well. So, and the final one is on the trend gap. Like I've talked about the lab, the pharmacy, even the nursing also. So these are the data has been captured. Simple, like it's like the tab or a mobile. They can use capture the data. Like rather than noting down in a paper, they just put it in a tab. And with that data, you can do a lot of wonders. However you want the reporting structures can be given through our system itself. It's not only any technology company can give. You can see here what is the intake and what is the output of chart is been prepared. Okay. So this is some of the clinical solutions. There are nearly 50 plus forms are there when you go into there. So we have implemented very successfully in some of the African and Middle East. And obviously there the patient take consulting time is little higher compared to our Indian environment. But still I feel like these technologies can definitely help doctors to give a proper diagnosis, and they can give a very good advice for a better treatment. Okay, this is the second one. And third one, again talking about the IoTs, like Internet of Things. Like so there are a lot of technologies available. So how do you going to use it? Like say AI, BI, IoTs, and lot of technologies there. It can be implemented easily. Like so when you have got a correct technology partner to implement, make your life easier. So IoTs is like it can helps you to capture all the data through equipment. Now you can see there all is like a proof of evidence is what is now happening. Like all the doctors has to give medication based on the data from a medical equipment or a radiology or a lab equipment or even a vital signs. So this is automated. Like when the entire scientific equipments like is been automated, why can't we use those data to pull it into a solution and helps them to for a better advices and medical advices results. See, there are few. This solution is like medical equipment interfacing and vital signs. Some of the benefits of this IoT is like the expenses definitely you can reduce. Like utilize your manpower properly, and with the data you can have a better advisory functions can be happen. Treatment results can be better. Mistakes will be reduced. Like so, with the data is automated. So what the data is coming from the equipments, if they're going to store it up, and without any manual intervention, for sure, like the mistakes will be reduced, and you can give a faster diagnosis. It's going to help in the ICU. So where we have been working with some Drager and the Siemens machine as well, where the ICU equipments is been there. So rather than a nurse been sitting there and alerting some of the doctors and the nurses to take a diagnosis, this will send an automatic alerting systems to the corresponding doctors and the nurses to take a faster diagnosis can be done. And this helps in maintenance of medical devices. Like so, hospital is investing in lot of equipments. You can see the asset is one of the major investment in an hospital, like ICU equipment or a lab or a radiology equipment. Whether those devices been maintained properly, so we don't get into those kind of functionalities. We more bother only into the revenue part, and then what is my EBITDA or what is my profitability. So get into this definitely will maintaining of equipment for sure. It's going to improve your EBITDA as well. We can assure you that. So these are some of the benefits if you're going to use an Internet of Things. I'm just quickly explain the IoT in lab environment. So we have developed a small USB kind of a device, so which is going to be useful across an hospital environment. We're going to launch next month in an international conference in Bangkok. So this enables so in the lab we have done for as I said 400 medical equipments. So the USB device helps you to connect the equipment, whatever it may be. It can be a vital signs, or it can be a lab equipment, or it can be an ICU or any equipment. What the functionality is throws out the data. It can be through a Wi-Fi or a Bluetooth or even a SIM inbuilt is there. So this helps you to transfer all the data and proper authentication, verification. This data can be used for a better diagnosis. Okay. This is on the IoT side, and I'm going to talk on the technology solutions as the BI. So we have explained about the IoT and the BI and some of the basic barcode solutions. So I'm going to talk about some of the business intelligence tools where you can have a better quality patient care. So data analysis, when you got a lot of data, I've been explaining about the lot of data through IoT machines and the barcode and thing. How effectively are you using this data into the real-time environment? So there are some tools like international, the top 5 you can say, like the Power BI and the ClickSense, which you use it extensively for customers. So the solution is, and the benefits are the real time. You can have an historical and the current performance of your hospital. It's going to be more interactive. You can drill down to the data in depth, like, so that either it can be a patient wise or a doctor wise or specialty wise. I'm going to show some of the screens for the reference. Even it can help you in predictive, like when this some of the states where dengue is there very common in particular month. So the hospital can prepare themselves to treat them as well. So accessibility. So through a BI, you can remotely sit and access all the data, whatever the necessary data to take some proper business decision as well. So you need to standardize the BI tool, or how we are going to approach to see any of the MIS report. So this standardization will help you in bottlenecks, like where exactly your problem. So the money you've been generating is being currently utilized for a proper quality care, or where exactly this money is been going, whether the investment, the return has come, or how you're going to use it. This all is going to be addressed in the BI solution. So I'm going to explain on the three solutions. For one is on the revenue, and other one is on the inventories, and other one is on the HR side. So here you can see the BI dashboards for the revenue. You can drill it down to specialty wise. You can see it's going to be a multi-specialty hospital. Which specialty gives you the more income, and you can even filter down to doctor wise, specialty wise, or even a department wise. It's a lab, pharmacy, physiotherapy. You can drill down to anything which is going to be your performance. And how is your participation, whether it's like through an OP, or how much is the OP turnover, IP, or an like a daycare or an emergency. And you can track down what is the age group of a patient, like whether it's a male, female, or an infant, or a children. It gives a full data. With the data, like we have already talked on the data, with the data you can play around like anything, and it will be more useful for some of the critical care areas. So next one is about the expired analysis. So I feel like this expiry is very important in an hospital. So this expire analysis helps you to track it down, like when the nearest expiry, and based on that you can able to utilize your working capital properly as well. So this is on expiry analysis. Next I'm going to talk about the HR. Like how is your HR, like how is your resources been there? What is the age bucket of your resources? Or is going to be year of services, or department wise, or education wise. So you can see here, you can slice down entire data, like however you want to see the data. It will be helpful, and you can where exactly you want to improve the quality, or in human resources, or inventory, or on any other revenue side. This technology solution definitely will help you to have a better performance. Okay, this is on the business intelligence part. So there are a few CRM solutions. There are a lot of, everyone is aware of the CRM solutions. How, like through a simple SMS, email, WhatsApp, and web portal, mobile app. This has been like very familiar nowadays on the mobile app and the web portal. So through these solutions, some of the benefits like communication between a patient and hospital and the doctors. So it can be utilized more properly, even like even a small reminders, even a lab, if HbA1c is there. So every 3 months once the patient has to come for a frequent checkup. Every 3 months he can do that. So this will alert, the system will automatically alert patient that you can come for an HbA1c, so that their glucose level can also be checked properly. And administrative mistakes can be avoided through simple solutions. Campaigning, this is much important for the campaigning, like what are the promotions activities you're doing, what is the latest innovations or new setups you've done. This will help you to do a simple technologies like WhatsApp. Now WhatsApp has been there, you can use a chatbot and many other technologies. So it will help you to use the technology rather than inventing this technology. Use this technology to improve your patient flow and revenue as well. And when you get into this security compliance is very important, and that's where we are. All the data has been encrypted. Even any of the specific data will be encrypted, and authentication, even a simple OTP message can help to have a data protected through the things actually. So this is on the CRM. So this is a cloud one. Like everyone is talking about the cloud technologies nowadays, like how it's going to be very useful in healthcare environments. There are two solutions which a hospital can benefit. So this is more into tier 1 cities where the internet is very good. IaaS is infrastructure as a service and SaaS, software as a service. So now the entire solution is, rather than an outright purchase, is getting into the rental mode. So that's been one of the best point for the hospital. The investment need not be upfront, and they can utilize pay as they use as well. So this will help better patient care across anywhere in the world. So doctor can, even if you want to have a private diagnosis, that can help. Data security is there. Obviously, this is as per the ISO 9000 quality and 27001. This data is there. Scalability, like, so need not to invest a huge server at this point of time. When your business grows or you want to expand into the number of branches, so then this will help you to scalability. No need to do an upfront investment, and return of investment is there for sure. The operation becomes easier. No need to have a infrastructure in an hospital where it's going to be very, very tough in nowadays, like with the shortage of resources. And the entire world is moving towards the cloud. And for sure 2025 is going to be more of the customers going to be in the cloud. So better, I would suggest you to use this cloud technology solution as well. Next, I'm talking about the artificial intelligence. Like this, from this, like I'm going to end my speech. So this artificial intelligence is like how to know. This is one of the topic. We are recently launching a product for the laboratories for support of the clinicians. It's a sale, like Sukraa artificial intelligence for laboratories, the real time, which means like we have already done a lot of IoTs, and with the data can be captured, interpretation data can be done. So this is like a 360-degree solution, and it helps you efficiency and productivity. So one of the multi-gated verification, whether your equipment calibration is done or QC is being done, and it comes up with a CDS, like clinical diagnosis support as well for the doctors. What exactly with the numbers, it doesn't help the clinicians. So we give a multi-gated auto verification and pathological decision support for the doctors, which will help a customized patient diagnosis can also be done. So this is the sale, the small thing, like how the gates, like I'm talking about the gates, 8 gates is there, like expired maintenance, which is going to be common for all the equipments, not only in the lab. Any equipment, you can have a track on the entire equipment maintenance. So unless the maintenance is there, the data, output of data, we are not sure whether it's proper. So we have been ensuring that the data is also perfect, so that clinical decision support can also be correct as well. So some of the gates like QC bracketing, critical results, how do you categorize the results? There are 100, 500 patients are there. How the data has been captured is a normal, and the critical care and abnormal. And the delta check, which helps, delta check is one of the things, tools which helps to compare our last 6 months, what is his glucose level or creatinine level, and based on that diagnosis can prescription can also be given. And the last one is on the clinical decision support. It supports like giving you, the doctor is been prone to diabetic, or even maybe we have done 150 algorithms which will help you to support the doctor, saying that the patient may prone to cardiac arrest, possibility of it in 4 to 5 years also. So this some of the algorithms we building with some of the medical doctors on board, and some of the advisory doctor advisory in our board as well. Yeah. So I'm heading up my speech. So there are some how to implement a technology, successful technology. So there are people think that it's been very tough, like unless it's a big process in implementing a solution. It's not that like fixing up some of the medical equipment or an equipment like an AC or fan. It's going to be a continuous process to have a benefit over that. So it's not only the IT team is responsible, but it's going to be the combined all department stakeholders. It's going to be the nurse or pharmacy, doctors, everyone has to be there to support our successful implementation. So mandate from management is very important, to set the goal and achieve what is there, and use the technology is going to be help them to achieve the goal as well. you have to have a infrastructure. Without infrastructure, definitely it's not going to help you in implementing any of the technology. And more important, you choose a right technology, and this is going to be one of the biggest challenge in this current environment. It's very tough to differentiate a solution. So it's like everyone says billing is there or a module is there. In depth, if you see, there are a lot of features may be missing, and it's going to be choose a right technology. And organized workflows will have a better process management can also be maintained. So this training and change management, so there should be always, even it's a small team, we should ensure that the team, what's happening in the hospital, we're going to solve the benefits of the technology and give a proper training. And once they implemented, the job is not over. It has to be a complete implementation support. Is the attrition rate is there? How is it digitally or physically? A training can also be given through a software vendor. So that much from my side. Thank you so much.